Hello everyone, my name is Jennifer Olegario. Today I'll be discussing the neurological condition of meningitis. We're going to explore how this condition impacts a client biologically, behaviorally, and developmentally, and how we as OTs can address deficits posed by meningitis to maintain client function and adapt occupational performance. To understand meningitis, we have to look at what's happening to the brain. Meningitis is an acute inflammation of the meninges, the three protective membranes keeping our brain and spinal cord intact: the dura mater, the arachnoid mater, and the pia mater. What happens is that a pathogen, like a bacteria or virus, breaks through the blood-brain barrier. Once it gets inside, it enters the cerebrospinal fluid. This triggers, in turn, a massive immune response, which causes severe cerebral edema or brain swelling, and this causes a dangerous increase in intracranial pressure. According to the neuroscience textbook by Lundy Ekman, bacterial meningitis is an infectious and inflammatory condition that typically has a subacute onset. In a clinical setting, this means that a client's symptoms worsen and hit their maximum severity over the course of a few days. During the acute phase, a client will present with a sudden high fever, complaints of a painful stiff neck, and may present with an altered mental status. Clients may also experience photophobia, meaning they become sensitive to light stimuli, which can negatively impact their initial tolerance for therapy sessions. When a severe condition like meningitis enters the picture, it completely reshapes the routines of the entire household. From a behavioral perspective, that altered mental status isn't just simple confusion. Because of the brain swelling and resulting irritation, one may observe increased lethargy, severe irritation or agitation, combativeness, or even delirium. It is important to remember that these aren't just psychological reactions. They are the direct behavioral manifestations of an acute brain injury. Loved ones may often shift into caregiver roles rapidly to manage these behaviors, which puts them at risk for burnout and frustration. As OTs, we have to look at this through a developmental lens because meningitis affects different populations across the lifespan in different ways. For our youngest clients, infants under a year old, their immune systems are still developing. The infection can completely disrupt critical early windows of neuroplasticity. This is posing a developmental risk leading to long-term conditions such as sensory neural hearing loss, cerebral palsy, or other global developmental delays. On the other hand, for adults over 65 years old, it can present differently. The disease often rapidly accelerates cognitive decline, suddenly shifting an older adult living independently to a confused individual needing maximum caregiver support. As OTs, preserving a client's ability to do things for themselves is paramount. So we have to look at how these biological and behavioral factors impact everyday occupations. First, let's look at bathing, toileting, and showering. The neurological inflammation caused by meningitis compromises a client's vestibular function and muscle tone. Because of this, their motor performance skills, such as their ability to align and stabilize their body, are significantly reduced. By implementing home modifications, such as adding a shower chair and grab bars, and a commode on top of a toilet, OTs can step in to minimize the risk of secondary complications from falls by adding upper body supports. Secondly, for functional mobility, decreased proprioception and increased sensory sensitivity can contribute to decreased safety awareness when negotiating the home environment. Motor skills, spatial awareness, and executive functions are impacted by the effects of meningitis, which poses a greater risk for client safety. We as OTs have to adapt their physical environment, such as removal of throw rugs and other tripping hazards, to ensure they can maneuver successfully in their home with reduced fall risk. Third, for personal hygiene and grooming, the cognitive impact of meningitis means clients struggle with executive functioning and information processing skills. They may have a hard time following directions, sustaining attention to task, and sequencing the steps of their self-care routine. OTs directly support the client through targeted education on compensatory strategies, such as external aids to support sequencing of multi-step hygiene tasks. We also educate caregivers on how to implement tactile and verbal cueing and appropriate physical assistance as needed so the client can continue to participate in their self-care tasks. To accurately assess where our clients are at after a meningitis attack, we use tools tailored to their developmental stage. I'd personally recommend the MOCA to assess cognitive deficits, the Berg Balance Scale to assess deficits in balance and stability, and for PEDS, the PDMS2 to track pediatric development in the case of any underlying developmental delays. Of course, safety is paramount, so during acute care, we must maintain strict droplet precautions and monitor their intracranial pressure closely during treatment. Ultimately, the role of occupation in the promotion of health benefits both the client and family members providing care. By understanding the biological, behavioral, and developmental aspects of meningitis, we as OTs can help clients sustain participation in their routines and ADLs. Thank you for listening.